Our brain itself is a contradiction. It's simultaneously our largest organ, but yet the one that we seem to understand the least. It signals our heart to beat, our lungs to breathe, but yet we struggle to understand how exactly these signals are sent. The cognitive enigma that enthralls me the most is neuropharmacology, the study of medications for your brain. Antidepressants typically come in one of two forms, either an SSRI, a selective serotonin reuptake inhibitor, or an MAOI, a monoamine oxidase inhibitor. SSRIs function through something known as competitive inhibition, whereas the molecule will go in and block the receptor that normally brings serotonin back up into the presynaptic neuron. This allows more serotonin to stay in the synaptic gap and hopefully get absorbed by the postsynaptic neuron. This, in turn, increases the amount of serotonin circulating in the brain and then decreases depressive symptoms. Increasingly, I've had several friends who I've personally seen struggle with their tolerance to antidepressants. They have to keep going on higher and higher dosage just to be able to function appropriately. My best friend is currently taking pure serotonin since regular antidepressants do not help his symptoms. Tolerance of antidepressants has increasingly become an issue as psychologists try to find ways to combat the horrors of depressive disorders. An issue that especially impacts the African American community, who are 20% more likely to suffer from serious mental issues. In addition to this, they are less likely to utilize mental health services due to a distrust of the American health system and a stigma around mental illness. When these services are utilized, African Americans usually are given I plan to major in neuroscience, then pursue my medical degree to become a psychiatrist in order to serve the needs of my community. As a Black mental health professional, I will provide the desperately needed representation within my community in order to make sure they get the highest standard of care. As a researcher, I will strive to develop an alternative antidepressant in order to fix the tolerance epidemic which is currently sweeping the nation. I will develop a drug that naturally manages the body's existing serotonin levels via the digestive system in order to reduce this widespread tolerance. This drug will utilize the fact that nearly 95% of our body's serotonin is synthesized in the gastrointestinal tract, specifically in the enterochromaffin cells of the inner mucosa, or the innermost layer of the gastrointestinal tract. By upregulating this already existing production, we can balance serotonin levels for those who have decreased levels, allowing not only for my best friend, but the rest of the African American community to outlast and not have to worry about their medication actually relieving their symptoms.